So there's a lot of technological advances have been going on for the past few decades, and then currently a lot of new things on the horizon. One of them that we are actively pursuing and using is artificial intelligence. So we have at our center we use artificial intelligence for analysis of the radiology imaging. So we have the Viz.ai platform where the artificial intelligence lives on the cloud, and all imaging is sent there. All CT angiograms are sent up there, and non-contrast CTs, and it's constantly screening for large vessel occlusions across our health system. And it's very nice because they've nicely integrated it with a phone-based app that you can everyone on the team can have. The same really with Rapid, the other company that produces the similar technology. And so if a large vessel occlusion is detected anywhere in our health system, we get a alert on our phone. So sometimes we have looked at it in our health system, and we have seen that it does improve time to treatments and time to detection of the large vessel occlusion. So that's a technology that's pretty much made it into our practice, and we really couldn't do without it right now. And then there's lots of technological advancements on the device side of things. So we were just talking about, we showed some cases in the session earlier using a new catheter that has a tiny balloon, the mini scepter, which when we inflate the balloon, we're able to embolize and inject embolic material into pathologies such as arteriovenous malformations or dural arteriovenous malformations. And at this point, we're able to cure by embolization some of these diseases or some of these patients that would otherwise have to go to surgery. And so that device is very navigable. You're able to get into very tiny vessels, which was not the case with prior balloon catheters. And so that technology is something that we're using more and more. There's other things on the horizon, like new devices to treat aneurysms. There's been recently a whole lot of interest in intrasaccular flow diverters, devices like the Webb device and the Contour device that allow us to treat aneurysms that we may have otherwise have had to send to surgery. So it's a device that you can place inside the aneurysm, and a little ball mesh that opens up and allows you to treat aneurysms that have a wide neck. And so that's something that's become widely in use over the last couple of years in the United States. And then the other thing that's in aneurysms is the flow diverter technology. They've now developed special coating on the devices that prevent or decrease the chance of forming clot on the flow diverters. So that has the potential for allowing us to use the device in the setting of acute hemorrhage. And so that's something that's currently just coming out and we're beginning to use.